Good evening, everybody, and welcome to BridgeBio's webinar discussing the Medicare Prescription Payment Plan. My name is Monica Bryant, and I'm absolutely delighted to be here with you tonight to talk a little bit about the most recent changes that we are seeing to the Medicare program. But before we do, just a little bit of housekeeping. I do have to share that BridgeBio is providing an honorarium to my organization in exchange for my participation in this event. As I mentioned, my name is Monica Bryant, and I am an attorney who has dedicated my career to trying to teach individuals about the legal and practical issues that can come up after a serious medical diagnosis. Oftentimes people wonder what's legal about healthcare, and actually almost everything, from what health insurance access we have to what our rights are in the employment space to what our insurance companies have to cover. And so all of this is based in the law and can be incredibly complicated and overwhelming to try to sort through. Now, I'm going to ask you to answer a question for us. I would love to know what your mindset around your prescription drug costs were last year in 2024, ranging from completely overwhelmed, didn't know where to start or what to do as a 1, all the way towards, yeah, it was pretty good compared to years in the past. I think that, the answers are certainly going to vary because depending on when someone started in their journey, when they were diagnosed, when they became eligible for certain types of health insurance, all of those factors might influence how you're feeling about your drug costs. So as I can see on the screen, we've got a pretty mixed bag. We'll just give everyone another minute or two to weigh in. But I'm seeing that actually, a fair number of you felt like, well, they were manageable. Certainly, I think that is better than having an overwhelming response that people were overwhelmed. But so that you all can see, why don't we go ahead and share those results for those of you at home. And I think we can see, from these results, it's a pretty mixed bag. But what we do know completely is that not a single one of you was totally pleased with how much they were having to pay for their prescription drug costs. So, what our hope for you to get out of today's webinar is that you will hopefully, by the end of our 30 minutes together, have a better understanding of the changes that are happening in Medicare prescription drug coverage this year, including the new out-of-pocket cap for prescription drug costs in Part D plans, the new Medicare Prescription Payment Plan that is, again, brand new this year. If you end up being interested in enrolling in this payment plan, we're going to talk about how you can go about doing that. Then I'm going to point you to some places where you can get some more information even after today's presentation. But before we do that, I want to make sure that we are all on the same page with respect to some terms that often get thrown around when we are talking about our health insurance costs. I often say that there should be a class in high school on health insurance and finances, because in order to really understand health insurance in this country, you have to understand the terms that are used, but rarely are we ever taught what these terms really mean. So starting with the cost just to have health insurance, that's referred to as your monthly premium. And that's a fixed dollar amount that you have to pay every single month just to have health insurance. And you're gonna pay that whether you go to the doctor or not. So it's very similar to having car insurance all year, but never getting into an accident and filing a claim. But then when you go and actually use your health insurance, you access healthcare, there's going to be some additional costs that you have to pay. And the first is your deductible. This is a fixed dollar amount that you have to pay each year before your health insurance kicks in. And the deductible amount is going to depend on the plan you have. You could have a $500 deductible, you could have a $5,000 deductible. But again, you have to pay it before your insurance kicks in. Once you reach that deductible, Then your insurance starts to share the cost of your health care. And that share of cost is a percentage. And that's referred to as a cost share or a co-insurance. So for example, you could have a plan with a cost share of 80-20, which means once you've met your deductible, insurance picks up 80% of your healthcare costs and you're responsible for 20%. But then many plans have an additional payment you may have to pay called a copayment. And this again is a fixed dollar amount that you're going to pay each time you get care. And it could depend on the plan, but it could also depend on the service. For example, it's really common to have a $20 copayment to go see your doctor, but a $30 copayment if you need to see a specialist, or a $250 copayment if you're going to go to the emergency room. So all of these different words mean different things, and you could have a plan that has all of these different payments in them. But one of the most important things that every single person should understand about their health insurance is if it has an out-of-pocket maximum and what it is. So the out-of-pocket maximum is a fixed dollar amount that represents the most you're going to pay out of pocket for your health care for the year. And depending on the type of plan you have, the way you get to that out-of-pocket maximum might be different. So for example, it could be that they're going to add up everything you pay towards your deductible and everything you pay towards your co-payments and your co-insurance. So it's everything except that monthly premium. And once you reach that out-of-pocket maximum, you can continue to go and get the care that you need, but you don't pay anything for it. Insurance will pick it up at 100% of the costs. So now that hopefully we understand the terms that get used, let's make sure we all understand what we're talking about with respect to Medicare. Medicare is the federal health insurance program that is for individuals who are U.S. citizens or permanent residents, and they are over the age of 65, or if they're under 65, they've been receiving Social Security Disability Insurance, otherwise known as SSDI, for 2 or more years. So these are individuals who have a disability that is keeping them from working. Or they could have end-stage renal disease or ALS. These are the only ways to access Medicare. We often talk about Medicare as if it is one thing, when in reality, it is multiple things, because Medicare is broken up into different parts. And each part of Medicare covers different pieces of your healthcare. Part A is hospital insurance. So if you are staying inpatient at a hospital, Part A is going to cover those costs. Generally speaking, if someone has worked and paid into the system, they are going to receive Part A premium free. Then there's Part B, which is your medical insurance. And this is going to cover things like doctor's visits, labs, imaging, some immunizations are covered under Part B. When we talk about Parts A and B together, that's referred to as original Medicare, because that's all that existed when Medicare was signed into law. Original Medicare is fee for service, which is just a fancy way of saying you can go to any doctor around the country that accepts Medicare. Anywhere. Oftentimes, when someone has original Medicare, they will also have something called Part D, and that is where we get prescription drug coverage. Part D plans are sold by private insurance companies. So you could have a private insurance company sell you your Part D plan. And because they're sold by private insurance companies, the costs are going to vary from company to company. But generally, there is going to be a monthly premium that you're paying for your Part D plan. There's an annual deductible. It could vary, but it can't be more than $590. And then there is a copayment or cost share. So you're going to have to pay a percentage of what those drugs cost you. I skipped over Part C, but Part C is an alternative to having original Medicare. Part C plans are also known as Medicare Advantage plans, and these are Medicare plans sold by private insurance companies that bundle all of the services you would get under Parts A and B. Most of them also include Part D coverage, so they also include prescription drug coverage. One of the major differentiations between original Medicare and Medicare Advantage is that in Medicare Advantage plans, there's a network of providers, and you have to stay within that network in order to have your care covered generally. So there's a little bit less choice with respect to the providers that you go and see. I wanted to make sure to cover the basics because we're going to talk about some of the changes that are happening in Part D specifically. But keep in mind that this refers to standalone Part D plans that you go and purchase from a private insurance company. It also includes changes that are happening if someone has their drug coverage through an Advantage plan. So whichever lane you're driving in, original Medicare or Medicare Advantage, what I'm going to talk about tonight applies to you. So now that we hopefully are all on the same page, let's talk about those changes. In 2022, a federal law was passed called the Inflation Reduction Act, or the IRA. And the IRA has tons of different programs. It touches lots of different areas. But of course, here we're talking about the changes that it made towards Medicare. And there's lots of different changes that collectively are really designed to help lower those prescription drug costs for people who have Medicare. It includes the ability of the federal government to negotiate with manufacturers for the prices. It encourages manufacturers to keep costs down. But perhaps most significantly for patients, there are two main changes that are really going to be critical when we talk about the costs that people are spending on their prescription drugs. And the first is that starting January 1st of 2025, there is now a $2,000 cap on prescription drug costs. This cap is going to be for drugs that you might go to a pharmacy and pick up in person, or if you are getting your drugs from a specialty pharmacy, it's going to include those drugs. This is incredibly significant. 2024 was the first year ever since we had prescription drug coverage in Medicare that we had any sort of cap, but it could be as high as $8,000. So in 2 short years with the Inflation Reduction Act, we've made significant progress to try to limit the unknown out-of-pocket expenses that patients are paying for their prescription drugs when they are on Medicare. So what does this actually look like in the real world? Well, here's a scenario where someone has had prescription drug costs in January, different costs in February, all the way through May. But once they've added up everything they've paid up until that point, you can see they've already reached that $2,000 cap. Then in June, perhaps they're diagnosed and prescribed a really expensive drug. At that point, that drug is covered by Medicare at 100%, and that individual doesn't have to pay anything for their prescriptions moving forward. So that $2,000 cap is pretty significant. But in addition to that $2,000 cap, the Inflation Reduction Act has created a program called the Medicare Prescription Payment Plan. And what this is exactly what it sounds like. It is a payment plan that allows individuals to spread out that $2,000 expense across multiple months. The details, of course, are going to depend on how much other drugs they've paid for and when they're diagnosed, but the idea is that there was a recognition that the individuals who are on Medicare are seniors, many times who have fixed incomes, and individuals with disabilities so severe they cannot work. And so having to come up with a $2,000 bill could be pretty challenging. So this Medicare Prescription Payment Plan is a big change. So I'd love to know, prior to sitting in this presentation, were you aware that this payment plan existed and that we were getting a $2,000 cap for these drugs? So I'm seeing answers come in, and again, it's looking like a mixed bag. A few of you were definitely aware of both of these programs, and I certainly applaud you for that. And then we also have some people who weren't aware of either, or who only knew one or the other. And I think that that's pretty reflective of most of America. These laws get passed, there's so much in them. The news may or may not do a great job of explaining how it's going to be helpful for the community. So if you weren't aware of either of these programs, trust that you are definitely not alone in that. But I want to make sure that when we hang up today, 100% of you can say that you were aware of this program. So what does this program actually do? As I've mentioned, it allows you to spread out the costs throughout the year. So who is this really going to benefit? Certainly individuals who have significant out-of-pocket costs. That could be someone who has a very expensive drug, or it could be someone that's taking multiple drugs, or potentially both. So if someone has very expensive drugs, this payment plan could be really beneficial. But keep in mind that it is just a payment plan. It doesn't actually lower the amount that you are going to pay. That $2,000 cap is still the cap that you are going to reach, likely. So it's not about saving money, but it's more about making it more accessible to pay for these expensive drugs by spreading out those costs throughout the year. So for someone who maybe chooses not to enroll in the plan, what does it look like when they actually go to pick up their prescriptions? They're going to, let's say, walk into the pharmacy, they're going to pay the full amount that they owe at that pharmacy before they pick it up. The only bill that they are going to receive from that insurance company that sold them the Part D plan is that monthly premium. So they pay for their drugs at the pharmacy, and they pay the insurance company just their monthly premium. But if someone does choose to enroll in the prescription payment plan, at that point, once they've enrolled, when they go to pick up that prescription, they don't pay anything at the pharmacy. Instead, they're actually going to get two different bills from the insurance company. One bill is going to be for their monthly premium, and one bill will be for whatever the monthly payment is for your drugs. So some differences there. Again, what does this look like if someone is prescribed a high-cost drug in January? Well, if they're going to reach that $2,000 cap in January, then that $2,000 gets spread out through the entire year, which comes out to be about $167 a month. They're going to pay that each month because they've already met their $2,000 cap. So what happens in February when they go to pick up their next month's drug? Well, they pick up that drug and they continue to only pay $167 because they've already met that $2,000 cap. So all they're paying are those monthly installments. But of course, not everybody is going to get diagnosed in January or prescribed that drug in January. So what happens if they've been chugging along and they don't get prescribed that expensive drug until June? Well, at that point, the math is a little bit different because the months that it's going to be spread out are fewer. So in this instance, they get prescribed it in June, they're going to pay about $286 a month. In July, when they go to get that drug for the next month, again, they don't pay anything except that $286 because they've already met the cap and they're just responsible for that monthly installment. So given now that you hopefully know a little bit more about the payment plan, do you think that being able to spread out your prescription drug costs would be beneficial? Would it be helpful? Perhaps unsurprisingly, we are not getting a mixed bag to this answer, and it's a pretty resounding yes. I'm seeing, more than 92% of you are saying that, yeah, this would be helpful to be able to spread out that money throughout that cost throughout the year. So given that most of you at least think that this would be beneficial, let's talk a little bit about how you would practically enroll. You may have already received enrollment information from the health insurance company you get your Part D coverage through. And that is something that those plans were required to do. But don't worry, if you are thinking, I didn't see it, I might have thrown it away, it's not a problem, because you can actually opt into the payment plan at any point during the year. This is not something that has to be done at your first fill if you haven't done it yet, but are just now finding out about it. So certainly you could call the insurance company that you purchased your Part D coverage and verbally ask to participate in the payment plan. The insurance companies will have an electronic form on their websites. You can also mail in a form to ask to enroll in this plan. But keep in mind that this is a absolutely voluntary plan. You are not required to enroll in this payment plan. There's no fee if you do opt into the program. And if you do opt into the program, you are just going to end up paying that $2,000, so your out-of-pocket maximum. You don't actually pay any interest on those monthly payments at all. So I am curious because, we can talk about what's supposed to happen, but I'm curious to know that prior to this presentation, where had you received information about this prescription payment plan? Did you not get it at all? Were you notified by Medicare, or maybe your insurance company sent you the information? Maybe your doctor told you, or your pharmacist might have shared this information with you, or maybe there's some other place you've gotten it from. Interesting. So we're seeing that, again, kind of mixed bag, that, that people are hearing about it from different places, that either they hadn't heard about it at all, or Medicare told them, or you got it from somewhere else. So I think what this really shows is that this is such a new program that there isn't the level of awareness that certainly from an advocate perspective we would want. And it's, in fact, why we're here tonight doing this program, to try to spread the word so that the people who could benefit from the program know about it. So I do want to share, there are a number of places where you could go to get more information about Medicare. So as I mentioned, your actual insurance company that's providing you your Part D plan should be including information about the prescription payment plan. But also Medicare.gov is a really useful resource. And I don't say that about all government websites, but Medicare.gov is a really, really beneficial resource, because in addition to just having basic information, there are some additional tools where you can actually input information about your medical needs, like what prescription drugs are you taking? Are you picking it up from a retail pharmacy, like one you would go to at a store, or do you get it mail order or a specialty pharmacy? And once you put in all that information, the tool, the Plan Finder tool on Medicare, will actually give you an estimate of what your total costs would be, and it'll help you actually figure out if you might benefit from enrolling in this prescription payment plan. So I'd love to know, before we open it up for questions from you all, now that, again, 100% of you should have more information about the prescription payment plan, what are your thoughts around how likely or unlikely you might be to enroll in the payment plan? So I'm seeing some responses trickle in slowly, but it seems like a majority of you are either likely or very likely to enroll in this program. So as I mentioned, I will open it up to questions in just a minute. So if you have questions that you would like answered, please take a moment to go ahead and include those in the Q&A box on Zoom, and then we'll get to as many as we can. And while we're waiting for the questions to come in, I did just want to share a wonderful resource that I hope you know about, which is BridgeBio's program called Forging Bridges. Forging Bridges is really all about providing personalized support to patients and their care partners along the continuum of care. And so they do that in a number of ways, including providing educational resources about disease-specific information, BridgeBio products, insurance coverage, of course, including Medicare Part D. But then the patient access liaison team will also be a continuous engagement with you if you want this, to help you enroll in financial assistance programs, copay assistance if you're eligible, and other sorts of assistance programs that you might benefit from as you continue along your treatment journey. And so if you're interested in connecting with a patient liaison, access liaison for one-on-one support, you can reach out in two main ways. So you can see the phone number here on the screen. You can also visit forgingbridges.com, and however you get to BridgeBio, they will make sure that you're connected with the correct patient access liaison based on where you are. One of the resources that Forging Bridges has is a whole web page that includes a guide on Medicare Part D and other resources. So this is a wonderful resource if you want to learn more about Part D coverage and what your various options are with respect to that. So the QR code will take you right to that website. Again, you can also get to it from Forging Bridges. So in summary, the Medicare Prescription Payment Plan is a way for you to spread out the out-of-pocket maximum of $2,000 across the plan year. And again, Medicare is a calendar year plan, so that $2,000 will renew each year, but for 2025, it's $2,000.